I've started to see, I've started to experience a bit of vicarious trauma through hearing and rehearing, and some patients provoke it, of some horrible events that have happened and things that they've done. How do you manage the? I can only imagine after doing this for decades, what the amount of vicarious trauma you've kind of experienced. How do you manage what you hear and what you see?
Yeah, well, I think the first is that you really need to acknowledge that actually this is that's one of your skills as a psychiatrist, and the forensic psychiatrist is to manage complex emotions and manage complex narratives and stories. And I mean, one of the ways you build up that is by practicing. So you practice interviewing people, you do therapy with people, you see people over time. You get supervised. I think that's probably one area that psychiatry does a lot better than other areas in medicine, and it's formalised into the training program as supervision. So I think, I had fantastic supervisors in psychiatry that, made sure that you thought about these kind of things and thought about how you're managing your life outside and how you're dealing with the, it is,
So is that what you would say makes a good supervisor? Like a supervisor that can think not just about your job, but also the other elements of life? And
I think that it's, without getting too overbearing and
Have you called your mother?
That there's, again, a sort of balance of that. And, someone who's able to model, a healthy interest in their career. And point you in directions where you might learn more and you might challenge you, and definitely things like peer review are crucial, so that you sit down with colleagues in a semi-formal way and go through what's happening. And you've got to look after your own health. Got to make sure that's a really a crucial thing for us all to do. Make sure you've got that while probably there's a little element of a calling to being a forensic psychiatrist, in that you feel like you've got this sort of important job, and it's got this important social role. It's also a job, and you've got to have a life outside of that. And I think, and many people in psychiatry will pursue their own psychotherapy, that they'll have a personal therapy through, at varying different times, and that might, help understand your own, psychological quirks, and how that's there. But vicarious trauma is an established fact, and it's a risk of working in lots of areas in medicine. I think probably, like working in this area, it's important about being open about that. Say, for example, our registrars do a what's called a Balint group, or a reflective practice group. It's named after a psychiatrist called Balint. So every fortnight, sit down and discuss, what's happening on a sort of more unconscious emotional level and a systemic level within the service, so that there's that understanding that's there as well.
Hey team, thank you so much for checking out that highlight clip from the Doctors Getting Coffee podcast that I run. If you want to see more clips, you can check out my YouTube channel, or if you want to listen to the whole thing, check out your favorite podcast app. If you want to support the podcast, consider buying us the next coffee at buymeacoffee.com/Dr. Sil. You can also join us as a YouTube member or a Patreon and get access to the full video podcast episode. Or you can just jump onto our Discord server and we can chat one-on-one. Thank you for your support, and I'll see you in the next video. Bye for now.